Welcome. Today we're diving into a complex and multifaceted condition called CRG syndrome. This rare genetic disorder affects multiple organ systems, presenting a unique set of challenges for those diagnosed. While it's a condition primarily affecting development, its impact on the nervous system is significant and deserves our attention. Join us as we explore the ins and outs of CRG syndrome, from its causes to its management. CRG syndrome is primarily caused by mutations in the CHD7 gene. This gene provides instructions for making a protein that plays a crucial role in chromatin remodeling. Chromatin is the structure that packages DNA within cells. The CHD7 protein is essential during early embryonic development, influencing the formation of various tissues and organs. A mutation in this gene disrupts this process, leading to the constellation of features we recognize as CRG syndrome. It's important to note that in some cases, a causative mutation in the CHD7 gene cannot be identified through routine genetic testing. The pathophysiology of CRG syndrome is complex and reflects the widespread role of the CHD7 protein during development. The CHD7 protein acts as a transcription regulator, meaning it controls the expression of other genes. When the CHD7 protein is dysfunctional, the normal development of various structures is disrupted. This includes, but is not limited to, the cranial nerves, which are essential for sensory and motor functions of the head and neck, the heart, the eyes, and the inner ears. The specific manifestation of the syndrome depends on which developmental pathways are most affected by the CHD7 mutation in each individual. Because of the cranial nerve involvement, many neurological symptoms arise. CRG syndrome is a rare disorder, estimated to occur in approximately 1 in 8, 500 to 10,000 live births. However, this number may be an underestimation, as some individuals with milder forms of the syndrome might go undiagnosed. There is no known predilection for specific ethnic groups or geographic regions. CRG syndrome affects individuals worldwide. CRG syndrome is characterized by a wide spectrum of signs and symptoms. The acronym CRG itself stands for many of the common features: coloboma, heart defects, atresia of the choni, retardation of growth and development, genital anda or urinary abnormalities, and ear abnormalities and deafness. But these are not the only features. Neurological involvement can manifest as hypotonia, low muscle tone, developmental delays, intellectual disability, balance problems due to inner ear malformations, feeding difficulties due to cranial nerve dysfunction, and sensory processing issues. Seizures can also occur in some individuals. The severity and combination of these symptoms vary significantly from person to person. Diagnosing CRG syndrome can be challenging due to the variability in presentation. There are established diagnostic criteria, which include major and minor features. A diagnosis is typically based on a clinical evaluation by a team of specialists, including geneticists, ophthalmologists, cardiologists, and otolaryngologists. Genetic testing for mutations in the CHD7 gene can confirm the diagnosis, but a negative genetic test does not rule out CRG syndrome, especially if the clinical features are strongly suggestive. It's also important to differentiate CRG syndrome from other conditions with overlapping features. CRG syndrome is not typically classified into specific types. However, individuals are often described based on the severity and combination of features they exhibit. The degree of involvement in each organ system varies significantly, leading to a wide range of presentations. Some individuals may have severe life-threatening complications, while others may have milder symptoms and a better prognosis. There are established scoring systems that help to establish a probable diagnosis. Currently, there is no cure for CRG syndrome. Treatment focuses on managing the individual's specific symptoms and improving their quality of life. This often requires a multidisciplinary approach involving a team of specialists. Early intervention programs, including physical therapy, occupational therapy, and speech therapy, are crucial for promoting development and maximizing functional abilities. Surgical interventions may be necessary to correct heart defects, chonal atresia, or other structural abnormalities. Hearing aids or cochlear implants can help improve hearing. Feeding tubes may be required to ensure adequate nutrition. Behavioral therapies can help address behavioral challenges. As CRG syndrome is a genetic disorder, there is no known way to prevent it. However, genetic counseling is recommended for families with a history of CRG syndrome. This can help them understand the risk of recurrence and make informed decisions about family planning. Prenatal testing, such as chorionic villus sampling or amniocentesis, can be performed to detect CHD7 mutations in the fetus, but it's important to weigh the risks and benefits of these procedures. The prognosis for individuals with CRG syndrome varies depending on the severity of their condition. Some individuals may have significant disabilities and require lifelong support, while others may lead relatively independent lives. Early diagnosis and comprehensive management are essential for improving outcomes. Recent research is focused on better understanding the role of the CHD7 gene in development and identifying potential therapeutic targets. Studies are also exploring the use of assistive technologies and innovative therapies to improve the quality of life for individuals with CRG syndrome. It is a condition that continues to be studied and understood, and as we learn more, better treatment and outcomes will come about. Support groups and advocacy organizations play a vital role in connecting families affected by CRE syndrome and providing resources and information.